Spanish flu, the one they mixed all together. They call it H5 something. It'd wipe out 1 million people, and there wouldn't be any reason for them to have a World War III. And if you go to WikiLeaks, they have a U.S. Embassy shopping list. And recently, a lot of them ordered vaccines to be so nice and hand out to the public. So, although this information has been out there, this report, whether we copied it or Is It True News put it up, and there have been very, very few who have looked at it. And that's why I'm doing the audio. And it might be too late for some, but have to get the information out there.
46. It seems to us that it's an intentional act upstream in the supply chain, said David Strunz, the chief executive officer of Waunakee, Wisconsin-based Scientific Protein. During the hearing, we don't know specifically where the drug's main ingredient was contaminated before reaching the Chinese factory of Baxter's supplier, Scientific Protein Laboratories. Executives of both companies testified at a U.S. House hearing today. The Food and Drug Administration suspects the contamination was deliberate, though there isn't proof, according to the agency. Baxter recalled heparin, used to prevent blood clots, in January of this year after reports of harmful side effects. Since January 2007, 81 people have died after allergic reactions, the FDA said on April 21. Tainted heparin made by other drug makers has been found in more than a dozen countries since Baxter's recall, and regulators have said they don't know how it was introduced. Some samples of Baxter's heparin were found contaminated with a cheaper substance known as oversulfated chondroitin sulfate, according to the company and the FDA, in a class action lawsuit filed January 5, 2009 by Joyce Ann Austin at the St. Clair County Circuit Court for compensation for scores of patients harmed by tainted heparin. The claim is made that Baxter altered the profile of the drug in an attempt to reduce costs. The lawsuit accuses Baxter of using a more dangerous and unapproved ingredient, OSCS, to dilute, or to substitute for the more costly, natural ingredient in heparin to reap greater profits as a result of utilizing cheap component parts. About 3,500 pig intestines are required to produce 2.2 pounds of raw heparin. While the suit did not quantify heparin mass relative to value, it was alleged that it costs Baxter $900 to produce heparin the old-fashioned way. It is alleged Baxter found a way to make that same amount of heparin for just $9, and the heparin, mimic OSCS, according to the lawsuit, was the key. The lawsuit notes that OSCS is not found in nature, and is not approved in the United States. Unapproved APA significantly increases the likelihood that exposed patients will experience adverse side effects and reactions that can result from the unapproved doses, the suit states. In other words, an unapproved API enhances the risk and danger. As of April 8, there have been 103 reported deaths in patients who received tainted heparin since January 1 of 2007, the suit states. Of those deaths, 91 were reported after January 1 of last year. On or about July 30, 2008, the U.S. Food and Drug Administration conclusively linked the deaths of patients infused with heparin to specific lots made by Baxter, the suit states. The specific lots of Baxter product tested positive for OSCS. Heparin crude lots received in August 2006 are said to have included material from an unacceptable workshop vendor, according to the suit. Raw material inventory records were incomplete. The control of material flow in the processing area was found to be inadequate, and a collection of outer foil bags containing heparin sodium were unlabeled. There was also no report or data to verify that the leachable for certain bags used for heparin sodium had been evaluated, according to the complaint.
Well, let's note something here. The forced vaccines. Do you hear that about the pig intestines? So whether you're Jewish or Muslim, you're going to get injected with pig. And the rest of us, they force on us with the crushing up monkey kidneys. Now, can you imagine how many poor monkeys have to suffer for that? There is no reason for monkey kidneys or pig intestines to be in these vaccines. But I can't find the word. It's not funny, but I'm going to use the word funny. I find it very funny, as in sinister funny, that the pig intestines are used, and you have religious people who are anti-pig consumption, and here they're going to be injected, or already have been injected with the vaccines if they did it voluntarily, but then again, they're going to be forced to be injected with this. Something to think about. Motivation. Get out there and...
47. Inspectors reported a breakdown in critical processing steps identified for heparin sodium USP process, a lack of an impurity profile established for heparin sodium, and a lack of evaluation for degradants. Manufacturing instructions were found to be incomplete, and there had been no verification performed for the reported USP test methods, when even the CEO of Baxter has said that the contamination of Baxter's blood thinner heparin appears to have been deliberate, and he has a strong sense of personal responsibility for this deliberate scheme. How much more likely is a deliberate contamination of the swine flu vaccine? We are alarmed that one of our products was used, in what appears to have been a deliberate scheme, to adulterate a life-saving medication, and that people have suffered as a result, Baxter Chief Executive Robert Parkinson said. http://www.reuters.com/article/topnews/itis/109407200800429. We deeply regret that this has happened, and I feel a strong sense of personal responsibility for these circumstances, he said. Under the current set of regulations, acts and provisions, it would be possible for a bioterrorist organization that has access to the production facilities or to the 1,200-liter bioreactors, or that could influence the composition of vaccine material to kill all Americans by contaminating the vaccine material and forcing them to take it without adequate checks or face being shot. Theoretically, the lethal effect of the vaccination could be delayed or triggered by a second substance. Dr. Mark Gerard predicted this bird flu disaster. He was, however, the one behind the decision of France to stop use of the Hep B vaccine due to autoimmune disease. He has seen Weber, this coming where the vaccines are not even worth the risk, and yet they keep recommending them. Dr. Mark Gerard was commissioned as a medical expert witness by a French judge in a criminal inquiry in France in September 1994 into deaths following a campaign of vaccination against hepatitis B upon the recommendations of the World Health Organization, WHO. In an open letter to the then WHO Director General, he indicates that WHO is guilty of criminal misconduct. http://www.impfcritic.de/forum/showthread.php T=534. While much information concerning World Health Organization (WHO) recommendations on vaccines, particularly against hepatitis B, remains secret, there is sufficient evidence in the open literature to suggest scientific incompetence, misconduct, or even criminal malfeasance. The benefits are overstated and toxicity greatly understated. Influenza vaccine recommendations falsely imply that the available vaccines could help prevent avian influenza, he writes. French judges investigate vaccine manufacturer for manslaughter manslaughter, March 19, 2008. In what was called a thunderclap in the vaccine industry, French authorities have opened a formal investigation concerning a hepatitis B vaccination campaign by GlaxoSmithKline, Sanofi Pasteur in the 1990s. It is alleged that the companies failed to fully disclose neurologic side effects. Another investigation opened by Judge Mary Odile Bertella Geffroy concerns the death